Hello everyone, welcome to today's podcast, Mantras from Managers. I'm Meghna from MBA second year, Paris School of Business, SRM AP. Today I'm excited to have Dr. V. Bhujanga Rao sir, who is a distinguished former scientist and Director General DRDO. And he is having nearly 43 years of experience in defense and R&D. He is now serving as a chairperson of KIMS Foundation and Research. Sir, we are honored to have you here and welcome to the podcast of Mantras from Managers.
Thank you, Meghna. It's nice meeting you. I've seen your campus. It's a very beautiful one.
Thank you, sir. The first question is related to the defense sector. What are the leadership lessons from the defense sector do you find that will be helpful for the young managers today?
The defense sector comprises of three services: Armed Forces, Air Force, Navy. In addition, there is also civilian employment opportunities in defense sector like DRDO. So, like leadership here basically means time management, discipline, then goal setting. They have a clear goals and completing these goals as per the plan of action. And they also spend time in opportunities to learn new things. There is scope for innovation, and also see they have to at times work in adversaries. So they're all trained in that. So that kind of things is also good for anybody, even in civil sector also. Yes. So whether you work in armed sector, armed forces areas or in civil sector anywhere, these qualities are very important for anybody to shine. And these days, knowledge is growing very fast, and individuals more or less all are become equally knowledgeable because of the available resources. Yes. At fingertips. So all these people should be plan for future, especially in innovation, in developing new systems, and most latest, which is like for Industrial Revolution 4, Industrial Revolution 5. Now we are in Industrial Revolution 5. So there they ask, Industrial Revolution 4 was a smart. Now it become AI is added into that. So in all these areas, I think the experience gained in defense sector will be very useful.
Yes. What are some of the ways like public and private partnership can help strengthen healthcare sector in India, and how do young professionals like us can contribute to that one?
There is a huge scope for public-private partnership in healthcare sector in India, because a vast country, and healthcare is one area which is really very important, but at the same time the expansion, there is a scope for expansion. Yes. And completely government sector giving healthcare for the people, I think is very difficult. Future will be very different. And so if we have this kind of PPP, I think we'll be able to enhance the services to even remote areas. Yes. Like villages and sectors which are not covered by the present healthcare system. And apart from that, see, there are many places are suffering for want of support structure. Like we may provide many new machines in a hospital, but who will maintain them? In government sector, maintenance is very difficult. Yes. Such things can be given to private sector. Similarly, you say pregnant women, that be taken from villages to cities or towns, and they travel today in an auto or in a small vehicles, which is very not good. And but they're doing it. So such accessibilities can be given. Number of these ambulances can be run by private people. Why should government try those things? So like that, if you go and see, there are many areas where the private sector can be combined with it is basically some kind of coexistence. Then it will serve the society like anything. So I feel it is a good thing if it can come in health sector. It is there some extent. For example, Apollo has tied up with Karnataka as the government. They're providing this service. And either there are many examples in healthcare. So I think it should be adopted, and rules should be modified such a way that private people can easily enter.
Yes, sir.
Today there are ambulances but sometimes we feel the employees are not fit for use for the purpose it is intended, because there are no maintenance. Such examples will not be there in future.
And coming to the third question, with the rise of digital technology, like there will be changes in healthcare as well. We are having digital health or telemedicines. So what are the type of technologies that will be emerging in healthcare in India?
Yeah. I mean, there is a tremendous growth of...
We are already seeing the robotic surgeries and everything.
True, robotic surgeries, which are very, I mean, they do better than a normal surgeon, but that doesn't mean surgeon is replaced. No, it only supports the surgeon. The robotic operations are much more better in terms of quality, in terms of medical skills. If you see, that is very good. Like there's one example which you have given, but there are many examples now, because today there are many new systems like Fitbit. One can have your own ECG, your own BP, your own things. But if you're using telemedicine, you can contact any doctor who is on the connected to those Fitbit machines and all that. So that way, people need not go to hospital for everything and unnecessarily waste their time, and also physicians' time. That one way we can do. And digital technology, there are something, for example, take ophthalmology. There's only one ophthalmology doctor for 15,000 patients. So how he can serve, we have 50,000 people. So, but if you have, for example, there are even normal mobile cameras fitted with some special high pixel cameras. A normal trained technician can take the fundus camera of the eye and transmit it to the nearest doctor. And now here again AI is coming. Yes, AI is able to interpret these signatures much better, sometimes better than doctor. They're already found in skin care, in ophthalmology, what I said. It gives as good as an expert's opinion. And if still doctor is in the loop, I'm not telling he cannot be replaced. He will be always in the loop, but he will be assisted by these kind of devices which are there. So I think this, what you said, digital transformations that is happening, and it is very, very fast. Now we had smart things, now it added, AI has added to it. Yes. And then there are people also talking something more in sixth things. Instead of AI, it will be a generative AI. Yes. It will be the sixth revolution. So if these things continue, and time between each revolution is also reduced these days, that means there will be a time where every day there will be a new revolution. If you keep extending, for argument's sake. So in that kind of space, I think digital telemedicine is going to play an important role, especially telemedicine. We know during COVID time how it helped, but we were not prepared. Yes. But if again COVID comes, I think we are much better prepared now. Yes. We will be able to handle much better. There would not have been so much of calamity like what we passed through. Okay.
Yes. Coming to the last question, I am very excited to ask you this question, sir. Like, how do you define your leadership style in one word?
No, I believe leadership style means it is a transformative leadership. That is what is needed, because as I said earlier, the knowledge levels are all going. There is a lot of scope for improvement, innovations, then startup companies. Although they're all transformations. Even Mother Teresa was called a transformational leader, because when I saw something, she changed the scenario quite a lot. So these are all transformative. That kind of leadership is needed for the country. We don't need dictators and even transactional and all those kind of leadership. So future will be a transformative. Also, otherwise maybe there is also another kind of leader-member exchange. That means in a group, instead of one person thinking, a single leader, all others can join. There could be an exchange properly, so that you will be much better leader-member exchange kind of leadership. That means you are giving a chance for the others also to grow along with you. Yes. So that kind of leadership is required. And I think the future is for such a transformative leadership, and this country needs it. Yes. So ours is a huge country. Sweden is a very small country. If you see Sweden, how many inventions have they made or how many innovations they have made. It's a big list.
Yes.
They are somewhere 12 or 10 in the index, whereas we are still behind 60 or 50 somewhere else now. So unless we all think in an innovative way, we will not able to do it. See?
Yes.
So there is a huge country, good young people are there. So it is a time to go for transformative leadership.
Yes. Thank you for being part of this podcast, sir. It's Mantra for Managers, and these wonderful insights for the audience will be really grateful, sir, from you.
Thank you very much.
Thank you, sir.
It's my pleasure too.